something I want to touch on again for our listeners. When we link cardiovascular health with sexual health, a lot of people are not aware of this. And as you said, Doc, as a physician, you weren't. As a physician, I wasn't aware of this. That erection possibilities, erection strength corresponds to cardiovascular health. And the link with this is the endothelial cell, endothelial dysfunction. And we talk a lot about this in our clinic. We're all about better endothelial health. The endothelium is the smooth muscle cells that dictate the size of our vessels, whether it's the vessels, the arteries in our penis, the arteries in our heart, the arteries in our neck that can cause stroke. If you have endothelial dysfunction, you're at risk of bad vascular problem. We call that vasculopathy. Yeah. And the canary in the mine, one of the first indicators is the penis. So if you have endothelial dysfunction in the penis, that is a leading indicator, something that shows you that has a strong correlation that you will likely develop endothelial dysfunction in the carotid artery leading to stroke, or in the heart leading to heart
something
disease.
Deeper to
yeah. So I think that's a really good, almost like a vital sign. If I'm checking blood pressure, BMI, body fat percentage, let's see how many erections.
I call it a 6 vital sign.
Yeah. It's amazing.
I mean, I didn't read on that. I didn't know, first of all, I like to explain the anatomy of an erection. Arteries take blood to the penis, capillaries exchange nutrients and oxygens and get rid of the waste, and then veins take it back up to the heart. It's a beautiful symphony that has to happen, right? And you have these mechanic receptors on your penis that are related to sensitivity. And if your penile tissue is not stretched enough, they can't activate, they can't release nitric oxide, stimulate the glycocalyx of the blood vessels. Therefore, you can't fully get an erection. Yeah.
And one of the things that I didn't realize we have an academic here. One of the things that the people don't realize about, guys, Carl's mentioned PD5 medications with Viagra and Cialis, brand names being the most commonly used ones. They put more blood into the penis, but they don't keep it there.
Right.
And if you go back to the original trials with Viagra back in the 1990s, it's only 20% more effective than placebo. We know with our data, we often don't notice any difference whether the guy's on Viagra, but the placebo effect is powerful. But in this area, I want to give people objective data, both for not as a diagnostic aid, but I also want to give people interventions that are objectively effective, and a heck of a lot more effective than 20%.
Yeah. Well, I think it's important now that we segue into the identifiers, now that you brought the PD5 inhibitors, and which, by the way, we learned from Dr. Nathan Bryan that PD5 inhibitors are downstream of nitric oxide. They don't stimulate the production of nitric oxide. They just help release what's already there. But in reality, what you need is a healthy production of nitric oxide to get an erection. Now, could we use PD5 inhibitors to enhance that? Yes, 100%. Now, I love my brother brought out something about the your FirmTech device, which I found phenomenal. A lot of men, what would you say, Doc? How many patients come with ED to us? Maybe 5 out of 10, 50% almost? Yeah. Before, we would give them 5 milligrams, 10 milligrams of Cialis and with some nitric oxide. But here's okay, wait, before we even give you anything, let's get you to wear this device to see where you score, which we'll get to later, how to measure the scores, all of that. But let's see where you are on the scale, and let's start with the lowest hanging fruit, nitric oxide. If that doesn't work, now we move over to medications and start with the lowest dose. Go slow, start slow, right? I love that about this device.
Well, data changes everything. If I went to a doctor right now or urologist and they just they tell me, they just give me a pill. The urologist will wave ultrasound over me. Well, let's draw an analogy to cardiology. If I went to a doctor right now and said I had chest pain, and he just felt my pulse and listened to my heart with a stethoscope and gave me digoxin, I think, what the fuck is this, 1900? We expect to have data-driven healthcare today, and it's shocking that when it comes to urology and gynecologists, and the same thing applies to women of the clitoris, they just have speculations, opinions, anecdotes as solutions. And that's what's so exciting about working with you gentlemen is you want to look for things that are objective, actionable, and personable.
And to echo what Miguel was saying, the cool thing about the device now, because look, we've been guilty of the same thing. Hey, look, and I love how Dr. Rudy labels it. It's not even dysfunction. Is guys who have erectile problems. Maybe it's not as reliable. I mean, they could get it, but it's not as hard or whatever the case may be. So with this, the cool thing, and we've been guilty the same as, hey, let's give you nitric oxide, Cialis and all this stuff because we know it works. And especially, obviously we tie that with lifestyle changes. But with this, you can start even at a lower hanging fruit. Hey, wear the device. Maybe work out 3 times a week. Maybe change your diet. Maybe lose a little weight and see how, maybe the nighttime erections improve. Because, the your technology measures not only the quantity, but the quality, right? Which is impressive.
9.2,
Right.
Which is impressive. I mean, listen, I got an erection. It says that I got an erection for 2 hours. That's almost unheard of. Like,
Way to go.
Call your provider. Okay, guys. So again, I like my order. So I think we've gone over the statistics. So let me kind of recap a little bit of the statistic that we said. ED, or like I like to call it EI, erectile issues, is a big problem.
Yes.
So we've said, 30 million?
30 million, which is a low number.
And I think this is underestimated.
Yeah.
As we were saying, maybe 25% in their 20s, 45% in their 50s. And this is what we call erectile dysfunction.
Yeah.
What about what you were saying, Carlos? The guy who's not a dysfunction, but maybe he doesn't have the same confidence in the strength of his erection.
Yeah.
He knows that he gets maybe a 50%, and now it gets into his head. What about the desire that's not there?
Right.
What about also the patients with premature ejaculation? Just cannot satisfy their woman. To me, that's an erectile issue.
Yeah.
And a true great sexual encounter is that you have a good, strong erection. You're able to maintain it enough so that both partners are satisfied.
Yeah.
If none of those things happen, then we have a problem. And we see that it's pretty big. So I think now the second thing we need to talk about is causes.
I'm interested in fitness. We all want to stay fit. Well, I'm not with these guys. You guys are all fucking ripped. Before there's dysfunction, there's fitness. So what can we? And you guys are using data and science to maintain your fitness. Now, it isn't blind. I'll try these hormones. I'll take these peptides. No, you're taking a scientific.
You saw today
approach.
how
I
we're
did,
tracking.
And that's what we want to provide here.
And this is groundbreaking. There's nobody else doing this. We weren't even aware that this was there. So we've looked into venous constriction devices for better erection.
What came up with constriction? That's like some Nazi word. I mean, who wants to put a constriction device on their dick? I mean, I have to digress for a second. Think what happened. I'm the oldest person here. I can go back to before you were born. You probably born then, but it's people who weren't. You go back to the 70s or 80s. Women could be described as hysteric, anorgasmic, frigid. I haven't heard the word frigid describe a woman in decades, seriously. But men still get whacked with impotent, limp dick, et cetera. We need to change the conversation from men to talk about how to maintain your fitness and not talk about things that are crutches, but things that are aids and enhancers.
And wherever your dick fitness is. Now, that's what I like with what you're saying. I don't want to just treat a dysfunction or a problem. We need to look at sexual wellness as a continuum, a spectrum, right? So whether you are at 10% of your best or 80% of your best sexual self, we can help with this. But if we don't measure it, there's nothing we can do about it.
I'll add one thing before we do the identifier that I love that you shared today with us, which makes sense. Wearing the device, for you to have a full-on erection, nocturnal erection, you have to be in deep sleep. This is a way of really knowing how well you're sleeping, because if you're not getting nocturnal erections, you're not getting any deep sleep.
That's right.
It's interesting that you said that, because when I looked at my stats today, the 2-hour erection was in that period, like right before you wake up, like the 2 hours before you get up, which is when your deepest part of your sleep is.
Yeah,
it's so interesting.
We have 2 to 3 cycles of sleep through the night, and you want 3 to 5 nocturnal erections.
Yeah, and I can show you my data later on, because I recently traveled to Europe, had a meeting in the morning in Europe. I couldn't get to sleep, so I took lorazepam and zolpidem, no nocturnal erections. Now, a lot of men are taking those things every night. Well, you're killing sexual health, killing the vascular health of your penis. I tried trazodone one night just because I was curious about it. I'd never taken it before. No nocturnal erections.
Wow.
And we have men who utilize this technology to change the medications for the better.
That's so powerful knowing. Yeah. That's incredible.
So let's hit the identifiers. Right? I'll just run through some of these and then we can talk about them briefly. And so we have endocrine disrupting chemicals, iron overload and hemochromatosis, hormone imbalances, using hair loss medications like 5-alpha reductive enzymes, highly processed seed oils, obesity, diabetes, cardiovascular disease, illicit drugs, and pornography.
Wow.
Yeah.
That's
So if I can
That's
go,
a lot.
yeah, and if we can go in
list.
order, almost like in most important order, if we think about this, what's the first thing we think about if you think in poor sexual health? You think in somebody that's unhealthy, who's overweight, obese, has prediabetes, has insulin resistance, has diabetes, has endothelial dysfunction. So this is what I think like the big bulk of the reason why we're seeing a lot of ED. So that's what, maybe 75% of the patients. But besides this, now we have to talk about the other things. Medication is a big reason, and there are so many medication. You talked about the 5-alpha reductase inhibitor, the hair type medication like finasteride,
Dutasteride,
dutasteride,
right.
strong correlation, but blood pressure medication, antidepressant medication, a lot of psychoactive medication, a lot of those things, blood pressure, like a beta blocker, it's detrimental to your sexual health.
The OBS have problems too. I took lisinopril for high blood pressure, which I got probably because I was involved in a startup company. It's gotten better now, but my erections went down 15%.
Yeah.
Now, why would I take a medication that's going to make my erections 15% weaker? And I was unaware of it because only 15%. But we have men who are on 4 or 5 medications. They're seeing 2 or 3 doctors. The doctors aren't talking to each other, and we tell everyone don't change your medications without discussing with the doctor. But I know they're not.
Yeah.
And we have men, reporting back to us. So thanks to your device, I stopped that, and I'm beta blocker or SSRI antidepressants being the worst. And I'm better.
So that's a big cause is medication. Another cause we have to talk about
alcohol?
in our society, alcohol, like any kind of drugs.
Yeah.
If you think about like alcohol is a big one. What about opioid medication?
Yeah.
Opioid medication
Painkillers.
decrease testosterone, any painkillers, and that's a big one in our society. Another big factor is porn-induced erectile dysfunction. In our society that now we have the phone that's available at all times, it's the fact that there's a name for it, PIED. It shows you that's another big reason.
Yeah, the porn one troubles me a bit because I think we get this image probably appropriate of men who are in their basement, watching porn continually. But I think porn impacts women as well too. I mean,
Big time.
I remember my daughter's back in high school. I'm a really good cook, and she had a bunch of her girlfriends over, junior year, and they were complaining about how small men's penises were at Bozeman High School in Montana. And I came over and said, "Really? They're small?" And yeah, I said, "The guys here are really small." I said, "You guys are watching porn, aren't you?"
Oh, wow.
and so I think it affects both sexes. Yeah.
How do you make an assessment on an entire city?
Right. I did point out to the girls that, and you guys are kind of flat. Girls are kind of flat chested too. But I had to point out a couple other things. If you don't mind talking about porn, one is women spend about 8 times as much time shopping online as men spend watching porn. But that doesn't get indicted at all for something that might be because they've shown that people who shop get the same kind of almost dopamine hits in their brain.
Words.
But we don't talk about shopping addiction for women. It's kind of a sexist thing going on here. I also think that it's probably true that men who if their primary form of having sex is masturbation, probably get addicted to the tightness of a hand. But and that could be bad, especially I think in younger guys. But one thing's been interesting in the business that I'm in is the number of the people talking about their sexual issues, the way in which they don't talk to their doctors, and a lot of older men feel that they're under pressure to have penetrative sex, but they actually need the firmer pressure of a hand in order to climax. So I think when it comes to porn, I think it's more complex. And to throw porn in there, to my mind, with the fact that we're poisoning everyone with microplastics, and we're impacting millions of people with antihypertensives that are affecting their erections, and we're giving them SSRI antidepressants that are going to kill their sexual pleasure. I'd rather focus more on those things, and I just don't like. I'm a little uncomfortable because I think when putting porn here.
Right, but let me give from my experience, because I grew up younger with porn. Now kids is even worse. Like it's everywhere. But I grew up with sort of having it on the phone, and I looked at the statistics. 30% of the internet is used for porn, and I imagine that could be even more in the future because it's so easily accessible. But just like how shopping and many other things are drugs, right? Porn tends to be the biggest drug that we can be exposed to because of the dopamine hits. And as a young boy, if I'm jerking off to be quite honest, I'm jerking off to a video, then my ability to want to hunt or try to go and actually get a woman to get off decreases, because I know I can go home and just jerk off to this illusionary fantasy that they're drawing. Because when I did get in sexual relationship, I thought I was supposed to sort of mimic what was on these videos, and it's far from it what women get turned on by. They're more emotional based, not by, I mean, we don't even have to discuss the scenes, but they're very aggressive, right? And I grew up thinking that's the way you're supposed to have sex. And no, that's far from it, right? Could you use pieces of it? Sure. But I thought that was the way of having sex.
So there's no question. I agree with you. We can't make too much of it, but the porn induced, and it's so easy, and the dopamine release and the false expectation, it is a factor that we have to talk about.
Sure.